I have lost a family member to suicide. I've lost a friend to suicide. And I myself am a survivor of a suicide attempt. And, it certainly gives me a very specific kind of perspective that I want to be able to share with other people.
All right, this is great. Happy Wednesday, everybody. Welcome back to another Public Health Roundtable live discussion. I'm your host, Dr. Charlotte Huntley, and I'm surrounded by brilliant public health professionals. We are all prepared to share on the topic of suicide awareness or suicide prevention. This is Suicide Awareness Month or Suicide Prevention Month, if I get pulling up my notes here to be correct. And we're going to talk about awareness and have some freedom to kind of move across this topic and really speak to what rises up for us and how we have these conversations among the communities that we serve. But before we dive into all of that, we want to go around and have introductions. So I will start. I am delighted to be here. It's been a rough August for me. So being back live feels a little weird, awkward for me, but at the same time, it feels very good to be walking in purpose and joining the conversation, leading the conversation on this important topic. So I am a public health entrepreneur. I lead a consulting firm that focuses on supporting large BIPOC organizations, nonprofit organizations, or government agencies, sometimes programs that are focused on serving BIPOC communities. And our support really is designed to help translate or convey their health information in plain language to the individuals within the communities. So it can look a variety of different ways, just depending on the needs of the organization. So if you're leading an organization of that type and you'd like to discuss what that support might look like to you, then feel free to send me a direct message and be happy to chat about it. I also support a group of professionals here that are entrepreneurs as well. So let's go around and I'm going to go in a counterclockwise in terms of the way I'm looking at my screen order. So Ericka, why don't you introduce yourself?
Sure. Good afternoon, everyone. My name is Ericka Horne, and it truly is an honor to be here this month, today, this Wednesday, to be talking about this topic. I am the CEO and founder of Akiri Consulting, and I have the distinct honor of serving nonprofit organizations, faith-based organizations, churches, and just help them with their program planning, event planning for anything related to health. So any health-related programs, whether it's a health fair or a program for a couple of weeks or a couple of months, and how can I support them and implementing programs for their organizations, their members, and also with mentoring organizations, especially with the youth. And so a lot of the work that I've been able to do around, suicide prevention is with youth and with adults. And I'm really excited about today's conversation and to be able to share. Thank you.
Wonderful introduction. Thank you. Dr. Linda Gordon, we'll go over to you.
Great. Hello, everyone. I'm here representing Childverse Inc. We are a company of one. I've been a pediatrician for over 20 years, and our company is a public health entity that seeks to prevent those crisis moments, including suicidal ideation and attempt, by decreasing the time to medical sophistication, giving parents, advocates, organizations those health literacy tools that empower them and promote access to resources and a hopeful worldview so that we are not in crisis, but achieving wellness.
Wonderful. Thank you for that introduction. And last but not least, Kristi, please introduce yourself.
Yes. Okay. So, my name is Dr. Kristi McClamroch. I just realized I need to update my profile name here. I am also a public health entrepreneur and consider myself to be a public health rock star. I'm trained as an epidemiologist, and I'm actually very excited to announce that I just formed my own public health consulting business called Courageous Public Health. So you can look for more information about that coming out soon. And one of the projects that I am working on right now is writing a book. It's a memoir, and it's about inherited trauma in my family, which certainly touches on some of what we're talking about today. So I'm really honored to be here with all of you. Yeah, thank you.
Thank you, Kristi. Great introductions. So if you're joining us live or if you're watching the replay, please introduce yourself in the comments. It gives us an opportunity to, not while we're live, but to come back in the comments and engage with you and keep our discussion and conversation going. As we chime in on this topic, also feel free to engage in the comments. Again, we will be continuing that discussion and following up. We get an alert or notification every time someone leaves a comment. So we would love to continue the conversation, really keep it going. So I'm going to dive into our topic a little bit. And looks like I'm scrambling around on my screen, but I have some things pulled up that I wanted to share with you during this time. So Suicide Prevention Month, I'm actually looking at the NAMI website, which is National Alliance on Mental Illness. And I know Amber, our team members, is with us in the comments. Amber, if you would also share this link in the comments, that would be great. This is an incredibly helpful link and a lot of resources. There are toolkits, a lot of information that you find helpful. We're going to talk about this topic and kind of how does this relate to us as we serve the communities. And through our introductions, you see that we have a very diverse group in terms of how, the type of organizations in the communities that we serve. But I just want to mention, okay, again, suicidal thoughts, much like mental health conditions, can affect anyone regardless of age, gender, or background. This month is about really focus on a time to raise awareness and the urgently important crisis. This is really a crisis. It seems like in public health, we have so many crises, but this is certainly in that list of, important topics that need our attention. So we are kind of shifting our focus and really helping with this public perception, because we know, as we've talked on this roundtable about mental illness and mental health topics in general, with especially regards to BIPOC communities, those are the things that get tucked away and packed away, and we need to find ways to bring these conversations up. It's not that it just flows smoothly. It's just really about having the conversation. I want to share just a few statistics, and then I'll kind of go around the table again with our experts here. Again, the site is incredibly resourceful and helpful, but toward the bottom, there are some statistics that I'll just kind of share a few that stood out to me. 79% of all people who die by suicide are male. So although more women than men attempt suicide, more men are 4 times more likely to actually die by suicide. Among U.S. adults, just speaking about prevalence, meaning, the amount that exists in our population, the prevalence of serious thoughts of suicide are 4.8% among U.S. adults. All right. So just think about that for a second. If you consider mixed or multiracial groups, it's up to 8.2%. If you think of American Indian, Alaska Native, it's 8.5%. If we compare that to young adult, age 18 to 25, it's 13%. It gets worse. High school students, 22%. And then LGBTQ plus youth, 41%. And that's the prevalence of serious thoughts of suicide. And that's the U.S. demographic. So regardless of how awkward it feels or how uncomfortable it feels, we need to be having these conversations. Those numbers are staggering. I'd like to go around the table, our virtual panel, and I'd like to just, I guess my question to all of you, as we generate this conversation and really wanting, again, encouraging our audience members, whether you're live or watching the replay, to really chime in on ideas you have, or if you have something that you're doing that works, or just whatever rises up for you. Let's keep this conversation going. But my question is, how are you leading and engaging in suicide prevention awareness conversations with communities that you serve? And we'll just go around. You can jump in wherever you feel led to, and share whatever insights you have on this topic. And we'll start with Ericka Horne.
Yeah, so I know previously I've talked about some of the work I do as a mental health first aid instructor. And I think throughout that training and how I'm able to help others in my everyday work outside of, even if I'm not training, is just learning how to check in and preparing those to be able to check in with those within their organization. So, working with young ladies and mentoring organizations and providing safe spaces for just the mentors to be able to look for signs and symptoms of not just suicide, or but all other mental illnesses, including depression and other things that may lead to it. But like, what are the root causes? Or if you do, like, just finding unique ways to do check-ins with the groups, or even with faith-based organizations and their leaders, like checking in with those who may serve in their ministry in any capacity, like just doing a mental check-in, like, and empowering those leading those organizations to be that face, to let them know that there's someone they can talk to. I think a lot of times, even in organizations that we work with, or that even we may be a part of, we show up, we may volunteer our time, we may be getting paid, and we like the work that we're doing, but we don't really take the time to consider the whole individual outside of, are these goals being met? We have a list of things, our objectives for the year, for the quarter that we want to get done. Are we meeting these expectations? But beyond the expectations being met, there are people behind those expectations being met. So I think what I've been able to do is empower those in those leadership positions to be able to say, hey, let's check in with your people every so often. It can be something fun, it could be different, it could be, hey, just drop a different color heart for how you're feeling, we could talk about it. Or it's different shapes, or drop a food, this food item, an apple means happy, a grape means sad, just being innovative in the ways that they're able to talk about mental health and check in internally on how the individual is. And so being able to provide those opportunities and empowering others to be able to say, okay, now that I have this information, now what? Then it allows space, a safe space for people to actually talk about the issues. And so that's really the heart of how I get to help. I think it's first and foremost going back to those that these organizations that I work with are serving, because you want them to be able to help, especially in the mentoring organizations. We have a lot of young ladies that are being, they're in school, they're seeing all the influence, they're on social media, and we know that plays a huge role these days. And the research is still going on about the impacts of social media on mental health. But we already know that it's been adverse, and there's been an increase in suicide rates, especially as you mentioned with the rates for teen suicide in those capacities. And so it's like understanding that, okay, this group of hurt people need extra attention. How do I help them? How do I get that attention? It's like, okay, empower those who are working with them so that they can recognize signs and symptoms, whether it's through the training. And I know it's also been recognized because I'm a mental health first aid instructor and I do it for adults, but they also have a youth mental health first aid. And it's even been to the point that now they have a specific teen mental health first aid. So they're finding ways, because they're realizing there needs to be more conversation specifically targeted to this group, this population that do need this extra attention. So I think the work is, the results are coming out, but it's really just empowering people to feel confident in reaching out to these populations. And that's some of the greatest work that I get to do when I'm working with my clients.
I like that. I like that, you're finding ways to make it really easy, because sometimes when you ask people how they're doing, it's like, it's almost a really hard question to answer. Trust me. I know, I like the different color hearts, the option to put a different color heart. That makes it easy to just, respond. I like that. Yeah. Dr. Gordon, same question for you. Like, how are you, hosting or leading these types of conversations in the communities that you serve?
So we use the flow of information through media, print media, digital media, social media to provide a safe space for the conversations. We want the conversations to be accessible. And so we use tools such as SEO optimization so that that parent who's in crisis is sitting in front of the computer types in, help, my child is suicidal, or help, I've just gotten a diagnosis of major depression for my child. We want to be a resource that is readily available. We want to be a safe space, and we want to listen, and we want to empower. So we use some of the concepts of marketing and digital media to guide parents to resources. So we want you to have resources from experts. We don't diagnose or treat through our company, but we lead you to the experts who do. We have links to American Academy of Pediatrics and National Association for the Mentally Ill. But one of our unique features is that we have a blog with subject matter experts. So if you want to hear from an educator, from a lawyer, from a therapist, from another parent, and just go from being medically unsophisticated and naive to well-versed in these are the next steps I need to take. I have these tools when I go into my conversation with my pediatrician or my therapist or psychiatrist. I know the landscape of the healthcare system, the educational system. I know what resources to access in my community. Just having that knowledge and awareness that doesn't come from hard knocks or crisis or even loss, but from other people's knowledge and experiences to move forward. So that's what we do. That's who we are. And by being a safe space, by being a resource, we hope we're also reducing stigma. Part of the stigma of mental illness and suicidal ideation and attempts is the isolation, the shame. And we want the information to be out there in the public sphere, accessible, and reach a level of consumption that the stigma is reduced.
No, that's really helpful. I know that sharing the resources is extremely valuable. It makes it,
Mhm.
especially if you're sharing public, thinking about both of you have mentioned, social media, not only is the person that it's intended for able to get that, but other people that are kind of
Mhm.
checking in or passing by, so to speak,
Mhm.
also have access to that. So that's really great. So, Kristi, over to you. Same question, like how are you addressing, this topic and in the context of, what you're doing, who you're serving, and hosting these
Yeah.
conversations?
Yeah. Well, yeah. Thank you, Erica and Linda, for all the work that you're doing. It's really, it's great stuff, and it's so needed. And Linda, you mentioned stigma, and I think that's really important. That it can be very difficult for people to talk about mental health and suicide, and that is one of the reasons that it's really important for me to write the book that I'm working on, to really share my experiences and the experience of my family for multiple generations dealing with trauma and the intergenerational transmission of trauma. I have lost a family member to suicide. I've lost a friend to suicide, and I myself am a survivor of a suicide attempt. And it certainly gives me a very specific kind of perspective that I want to be able to share with other people. I want to be able to say, you know what, this is reality. Like, this happens, and this is a part of people's lives, and it's nothing to be ashamed of, right? It's actually, it's so empowering to be able to share my experience with other people. So rather than feeling like I need to hide in the shadows, I'd actually very much rather come out into the light and say, if what I've experienced and what I've gone through and what my family has gone through, if that can help other people, even one other person, then that's powerful. Like, that's worth it then. So I guess I do come at this. I'm a big proponent of intentionally making use of my personal and my professional. Like, I think that it's a good thing for my personal to impact my professional, and certainly as a public health professional, this topic, mental health awareness, I mean, these are very important. And I'm so glad that we're finally at a place where these topics are getting more attention, because for so long they were getting no attention. It still needs more. Like, we still need more. But yeah, I mean, that's why I'm really grateful to be here today and to be, with this group of women, public health rock stars who are, committed to making a difference in people's lives, and mental health, and it's mental health well-being, it's mental health, it's mental illness, but it's also just like quality of life. Like, this impacts quality of life in such profound ways. Yeah, I'm just really happy to be part of this conversation. So thank you.
Wow. First of all, thank you for the, choosing to be vulnerable and sharing that with us. I mean, it kind of brings the meaning to your new business, Courageous Public Health. It takes courage to share in the way that you did, and to step forward and to really, decide that I'm going to help, I'm going to share this, in a way, that may help one person even. Great discussion. I've heard such strong words from each of you. I'm going to share, we're going to go back around one more time and give you all the opportunity to, comment, add to, and just as we kind of wrap up and close up. This has been a very impactful conversation. I think it's been, like I said at the beginning, a difficult conversation to have, but it doesn't mean that we shy away from difficult things. This is an important conversation to have. We need to, I guess, stumble through it in whatever way that makes it work. And hopefully that our people watching, both live and with the recording, are able to, share their thoughts and ponder a little bit, and just have some takeaways. So I'm going to start with, in the same order, with you, Ericka, just a chance to share, any final thoughts or takeaways, anything you'd like to add to our discussion today.
Thank you. So as I was listening to Dr. Linda and Dr. Kristi, two things that stuck out, talking about stigma and talking about resources. And I know initially we talked about the public health crisis around suicide, and it really is a public health threat. And acknowledging that there are still a lot of gaps that need to be addressed. So I know I may talk about the things I'm able to do, how do you check in with each other? But then it's also looking at those additional gaps that need to be addressed. And there is some data that shows, there's still a lot of gaps in social, economic risk factors, legal issues, exposure to violence, different financial strain that may be on the individual's, poverty, relationship challenges. But even if somebody isn't in a position to be able to say, okay, I have someone to speak to, or, I have a therapist or someone I can talk to, if we just consider those additional barriers that people are facing that may put them in the predicament of having these suicidal ideations, I think as a whole, we'll be doing a better service to each other, to this earth. So considering, okay, I know this person may be, they're struggling, financially, there's work issues, there's family issues, marriage issues, children issues, different struggles in their relationships. But considering those things when we interact with one another makes a difference, because those same situations that people may look at as, oh, this, they may write somebody off because of those things. You writing that person off may push pushes them over the edge. So, I would say as individuals, as people working in public health, people not working in public health, people who work in social services, people who say they love people and just want to help others and serve others, even if it's not something that you get paid for, but truly checking in on somebody and being able to acknowledge what they're dealing with. The stress of school, the stress of work, the stress of a relationship, just acknowledging those specific instances helps other people to want to live longer lives, because then they see that people actually care for them. So if anything, if not anything, if we continue to show that we care for each other, I think that will help play a role in, slightly addressing those barriers that people are facing that put them in situations where they do want to consider suicide. So I just like to, say great conversation. I enjoyed it, and just encourage others to consider other people.
Thank you, Ericka. Dr. Linda Gordon.
Child needs specifically, children need to have safety at home. So, referencing some of Ericka's statements, they need economic security, food security, housing security. Parent social determinants of health that are at risk need to be addressed. They need safety at school. So, really combating bullying in all its forms and combating risk for assault. And they need less access to weapons of suicide. So firearms, drugs, any devices that would be, used to inflict harm. And I would say as professionals, and then also as our civic duty, really working on reducing the stigma, being that safe space and being both emotionally and physically present. That's something that we can do.
Thank you for that. It's wonderful feedback. And Dr. Kristi McClamroch, your final thoughts.
Thank you so much. Yeah, I was writing a few things down when you were both talking, and I think that the idea of empowering people in leadership roles, I think that's really, really important. And I mean, people in leadership roles also deal with mental health challenges, right? I mean, I think sometimes we can forget that, right? People put on a happy face or a strong presence, or they show up and they're able to get things done, and that doesn't mean that there are not other things going on in their lives. I mean, we all know this, right? We may not share everything that's going on in our lives, but there's always other stuff happening. So that's something that I think is really important. And also, yeah, I mean, the idea of providing resources for people, that's so important. That's so important. The other thing I just wanted to say is that one of the things that I'm trying to do, which I think is maybe a little bit different, is to talk about my experience, talk about my family's experience with trauma, with mental health, through a public health lens. So, I mean, I think there have been lots of accounts of people, in the similar positions, but I'm not sure how often that's been done by someone who brings a public health perspective. And that's something that I am hoping to be able to add to what's already out there. So, yeah. Thank you, Charlotte. Thank you.
I really enjoyed this roundtable. I think each month we do this, I say, okay, this is my favorite. This was very personally rewarding and therapeutic for me. I love all of your takeaways. And I do love that we keep revisiting this, this umbrella of mental health and these conversations. So as I listen to each of you, and I had to share this one last because I wasn't sure I could actually say it, but leading from like Kristi, a lot of you have already aware of this, but I lost my stepson last month, not to suicide, but to a motorcycle accident. But it triggered a lot of, I won't say triggered, our, mental health, everything about mental health within myself, my family is just like open nerves and all over the place. And some of the best experiences, a couple things like what from, what Ericka said about, people checking in. Like there's a couple people, or one in particular that came to me and said, sometimes it's okay to not be okay. And right now things are just not okay. And she hugged me and we cried. And sometimes I think about that when I want to cry and I'm thinking, oh, I got to hold it together. I'm like, no, I don't really have to hold it together right now. So people that check in like that, and I'll get a message every now and then, they'll just say, sending you a hug, like those things, really, really important. And then, resources like what Dr. Linda's saying, I had this post on LinkedIn and there's hundreds of comments, individual comments. We're almost, it's like 470 something individual comments. And I promise I'm going through all of them because they're like hugs for me. So I've gone through about 100 or so far. And as I go through them, it is so reassuring to me because people are sharing resources. To Dr. Linda Gordon's point, people are sharing resources. So while I'm going through it on my laptop, I literally kind of curl up in that chair back there with my laptop and I start going through some of the comments. And then I open my notes on my phone. And as they share resources, I copy them over so that I can, like, the title of books and, links to podcasts and support groups and just so much value shared in the comments. I'm thinking not only am I getting to get this, but other people that are going through the comments are also benefiting from seeing that. So I find that the points that each of you made have been like, I've been an example of that. So this has just been such a personally rewarding roundtable. So I hope that people that are watching, or whether live or the replay, are getting something from this. Please share it with your network because you never know who could really need to hear the conversation today. And I encourage you to connect with us. If you're not already connected with us, our names are on the screen here. Connect with us and let's just continue to grow our networks with thoughtful, caring people who are courageous enough to have these types of conversations. So until next time, we'll see you all back here next month, a different topic. But thank you for being with us and engaging with us in this discussion.